Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right wisdom tooth. As you can see, this is a completely erupted lower right wisdom tooth, but however, it is lingually tilted. And if we can show you the lingual aspect, there we go. So this is where the tooth is. The patient has complained of pericoronitis here. So there you can see there's a huge pocket at the distal margin of the wisdom tooth. Now moving to the panoramic view. On the panoramic view, you can see that the lower right wisdom inferior alveolar nerve is quite significantly associated with the roots of the wisdom tooth. On the transaxial view, which is basically the proximal view, we will be able to show you how the tooth actually looks. So this is the transaxial view. We're going to zoom in, and there we go. Sorry. There we go. Right. So here you can see that the inferior alveolar nerve is placed on the lingual aspect of the wisdom tooth, and this is the mesial root of the lower right wisdom tooth. Now, as we are moving distally, you will be able to appreciate that the inferior alveolar nerve moves and changes its position, and now it is quite significantly close to the distal root, and you can see it is still placed nasally, but it is in complete or direct contact with the tooth. And if I remove the highlighting for our kind doctor, so then you'll be able to see how the inferior alveolar canal gets very slightly compressed. So any kind of movement can result in slight damage to the inferior alveolar nerve. So this is how it is. This is the normal architecture, and this is how the canal appears right here. So this is where the inferior alveolar nerve canal is, and as you move distally, it actually just travels slightly superiorly, and now at this point you can see how closely in contact it is with the nerve. From the axial view, which is the top to bottom view, you will be able to actually appreciate this is the lower right wisdom tooth, and as we are moving inferiorly, this is the inferior alveolar nerve, and then it comes in contact here with the distal root. It's slightly lingually placed, travels interdentally, and then is still lingually placed. The medial root is fine, the interdental area is fine. The distal is where we can actually see that the nerve is quite significantly closed right there. So caution needs to be practiced when extracting this lower right wisdom tooth. If there are any further questions, please feel free to reach to our team. Thank you very much.